But there are 10 different atypical antipsychotic drugs that are used to treat schizophrenia and/or bipolar disorders. And so those are drugs that are approved for that purpose. These drugs are not approved to be used with people with dementia. In fact, can you go to the next slide, Lori? In fact, these drugs have what's known as a black box warning. And black box warning is the highest degree of warning that the FDA will put on a drug. And it literally they put a black box around the warning. It's like literally a written black box. But most of the people who are dispensing drugs in a nursing facility don't see the labels. The drugs are distributed by the pharmacist and it come out on a tray, as you've probably all seen, and they're ready to be just given to the person, given to the people on the floor, but they're not. So this packet insert is not actually seen by most of the people who are administering the drugs. So, and I've taken depositions of doctors who didn't even realize that these drugs have a black box warning, which is kind of terrifying if you're prescribing them. Can we go to the next slide? So this is a list from the FDA of the drugs with their name brand as well as their generic brand. And I believe that Lori's folks have an insert that they can distribute that people can just carry with them in their bag or in their briefcase or on their notebook to just know that these are the drugs you want to be watchful of. There's some of them that are not listed here that are also have dangerous impact. But so we had a case recently where Geodon, the fourth one down here, was given. And the gentleman who was given the Geodon, when his family said you must take him off, they cut it cold turkey. And that was when he started shifting, and he was shifting so much, and he was rubbing his feet on the ground from his wheelchair, that he literally wore the skin right off of his feet, because that's how much he was so agitated with the abrupt stopping of the Geodon. So these things need to be addressed in a way. You don't want to just say take them off right now. They have to be addressed in a way that is carefully and watchfully done with physician supervision. Go to the next slide. So, for example, here's the warning label for Geodon. Geodon says elderly patients with dementia-related psychosis or psychosis treated with an antipsychotic drug are at an increased risk of death. So that's pretty serious, increased risk of death. And it's actually about a 5-fold risk of death. So it's quite an extensive risk of death. And when you look, I've talked to so many experts over the years about this, but one of the experts that we worked with was pointing out to me that the study, I think it's maybe the Resveratrol study, when they look at the folks that they were evaluating, they were actually like people who are maybe 60 to 65. So imagine if you've got a person with dementia who's 85, and they are having even more complications from these drugs because they're dealing with other consequences of health problems as they got older. The Seroquel warning is very similar and indicates that this is just simply not approved for elderly patients with dementia-related psychosis. So that's something interesting to see. I've had cases where the diagnosis overnight went from dementia to dementia-related psychosis. And then suddenly the drug started. It was actually a Seroquel, a person given Seroquel. So you do have to watch for diagnosis changes, because that sometimes you see that as a precursor to when the drugs are started, because that should not happen. You shouldn't, somebody doesn't just suddenly become, well, they certainly aren't going to become schizophrenic for the first time late, in their 80s. But the word psychosis, if it's never been used to describe a resident, you shouldn't just have all of a sudden emerged psychosis diagnosis. That should send off alarm bells, and you should ask people, where did that come from? What manifestations of psychosis did you see? And families should ask those questions, as well as staff in nursing facilities. but certainly ombudsman.